How do you use mindfulness to really be there with our patients, your patients? Yeah. How can we really do as your story said, be with them in the here and now and really understand what they need to be well?
Yeah. So the first thing that comes to mind with that is, how do I actually help the patient become present? See, I can be present, but maybe the patient isn't. Because I'll say something like to the patient, which is not just helping me, but it's helping them. I say, let's just take a minute to collect ourselves and get ourselves here. So how about this? How about if you just center yourself any way that you want to, and I'll just do the same. We'll just take a couple minutes just to pull ourselves together. Because we both came from somewhere, didn't we? And it might just be a minute. And most of the time they don't ask for guidance. Most of the time they kind of know what that means. But sometimes if I say, do you want a little help? And they might say, yes, okay, well, how about this? Why don't we just both just settle into our body right now, and then, how about if we create a stretch? I have my eyes closed, you have your eyes closed, but let's just both stretch and actually feel the stretch. And then on an exhalation, just feel the air leaving the body and just settle into the body. So I introduce a technique right from the very beginning that says, let's get our both selves here in the room. Then the next piece of this, which I think is really important, in the world of meditation, it's called beginner's mind or not know mind. And so I basically say to the patient, I really don't know anything about you. So I'm not carrying a chart in saying, here's your life and I know what's in it. I just say, I really don't know. I don't know anything about you. So I'm kind of curious as to what it is you'd like to tell me. Now there's 3 elements in a meditation practice. One is, can you stay relaxed? Relaxed meaning, can you be spacious enough so that something actually can show itself? If you're tight and you're too urgent, things recoil and it's harder to, present. So say, if we have stay relaxed, stay present, and be curious, how can I help the patient actually experience it without saying, here's what we're going to do? So I might say, well, let's do a little practice through the lens of mindfulness where we'll do a little deeper centering practice, and then we'll start to be curious about what it is that's actually arising around this circumstance that you're experiencing. So I do a little guided meditation practice where I'm primarily trying to get them to experience themselves in their body and to actually drop out of the conditioned, rehearsed, told over and over again story. So I get them to go underneath the head, and we do kind of a modified body scan experience where they're just centering, and then I'll say something like, so kind of notice, where is your body wanting attention? Especially if it's chronic pain, people. And again, often it's not at the site of pain. But let's just be curious and bring attention to that place. So let's say if often it's the heart center or the jaw too. And then just bring awareness there, and let's just notice it, and let's just braille your way into it as if you're blind. That's some of the language I use. And then they're just with it. And I'll say, okay, now, what comes up? What do you notice? And I say it can be a word or a phrase. Then they might say a word or a phrase. I'll say, thank you. Then him go back in. Notice what comes up. Just a word or a phrase. Then we lay it out. It's amazing, David, what comes up. So I just say, it's like we're laying it out on the table. So my experience is when together I can help the patient just become centered, adopt an attitude of really don't know what's going on. So I embody that, and to kind of encourage that perhaps they don't even know either. They have an idea about it, and then to drop the topic of, well, it's right here, but rather let's do a whole body journey, and then let's see where you're drawn now, the now moment. And then the curiosity, you're training curiosity to say, let's just lay it out. And then they start to lay out this agenda, which may be very different than the agenda that they came in with. Another key piece in this is, so we've got helping someone get centered, we have helping them adopt an attitude of don't know, so that they're not becoming a prisoner of their expertise about something, but rather softening around, there may be plenty here that I actually haven't brought to consciousness. Really, third piece is this tenderness around, can they sit back and become a witness to their experience and let it unfold? And then, of course, when you hit the hard place, or a place where there is a reaction or fear or a tightness, then how do you teach in the moment how to bring actually compassion to it? And I'm pretty direct with that in an encounter, and I actually talk about that. So the vulnerable place, I might say something like that, so does that feel pretty vulnerable? Is that a place that you might say, this is kind of sore, it's tender? And I say, you know, there's a sweet practice in the tradition of mindfulness where we recognize it, and you don't dig up your sleeves and say, now I'm going to fix this. But rather, you just bring kind of a soft breath of tenderness to it. Just say, may I have compassion for this vulnerability. So the original story, the physician and the patient, you know, that physician, she named what was present. Honestly, there's nothing more we can do. But she helped create a bigger space where she said, I'd like to offer you a possibility here, which is still grounded in presence. And then even when asked what happens, she really opened it up to compassion. So what she did for the patient in that moment is she said, fix it, fix it, fix it is just a total identity with the cancer, right? She blew some space in the midst of pain. There's nothing more we can do. You could leave the patient there, and maybe they'll stay there, but she gave an opportunity to say, look, this is such an important and powerful time. This whole idea of I'm willing to enter into now the uncontrollable mystery of a human life. So the work of hospice. We're not pretending anymore when you come, we're going to fix this. We're saying, well, we're in this phase of life, and you will not be abandoned. We're going to walk with you through it.